we're going to actually teach you the right way to swallow. I never was taught the right way to swallow, so I had to teach myself. And this appliance kind of does it automatically. So you lift your tongue, and do you feel these two prongs? You can feel them if you want to. In your mouth, they're going to feel like mountains. They're not that big, but in your mouth, everything feels about 100 times bigger. So you lift your tongue, and when you hit those prongs, you're going to swallow. And the first couple of times, you're going to kind of have to think about it, but then it becomes automatic. And if you wear this at night, every night, and I don't know, do they instruct her 2 hours a day? Maybe 2 hours a day? You'll swallow the right way 750 times a day. Isn't that crazy? So how soon do you think the habit will be changed? Pretty darn quick. It's like a couple days. So it'll become automatic, but that's the right way to swallow. So even when it comes out, the other times of the day, you'll be swallowing properly. And then when you go to sleep at night, we're going to make sure you're breathing through your nose. So what I will tell you is, in these appliances, swallowing, we talked about it, you swallow twice a minute during the day. So if this child is wearing a hammer corrector 2 hours a day and at night, they're actually repeating that swallow 750 times. You go to a speech therapist, they're going to beg you to do it 20 times. Okay, we all know how that works sometimes with the kids. Did you do the exercise? Yeah, I think so. How many did you do? Oh, I did 20. And you know, you're with them, they did 2. You know, so this way we repeat it so many times that if you're early on, I mean, it can be a day that you correct a habit. Maybe it's a week, but it's very quick because you're doing it so often during the day. And it's automatic.
So yes, by wearing this appliance, if she does have a little bit of a gagging reflex, it's going to take some time for her to get used to wearing this. She'll wear it at night only, and it will retrain her to breathe and to swallow properly, and for her tongue to be in the proper position.
Okay, I have a deviated swallow, so look at it.
Let me see that. Just take a picture of you.
Yes, see
A lot of
how-
muscle
that-
movement.
look at that
Yeah,
muscle.
gotcha,
Now, I've been
gotcha.
watching him for 5 minutes here, and he swallows twice a minute, and I haven't seen any
Very
facial
observant.
movement. And I mean, that's a better test
Yeah,
than, if
that's
you
true.
drink milk, they're almost all, or water like that, they're always gonna make some movement. And I see diagnosis coming through in almost every case, oh, they've got swallowing problems.
But most
I know-
likely not.
I know they don't have that
Okay.
probably, but,
For some of the symptoms that you filled out, again, one's a 4 and 5 on that scale, but that's a little bit higher. You've been recognizing that she's having some issues in the past few months. So this isn't something that she'll be able to wear in one night.
Would it
throughout
be
the
just
whole
like
night.
this, the size?
Yeah,
exactly
it'd be
like
just
that?
the size,
Ooh,
yeah.
that's big for them.
So
So is it different from a regular night guard?
it is. It's very, very different. It's designed very differently to not only retrain the tongue, absolutely, it can retrain the tongue and help her learn to breathe properly. Okay.